Welcome to the Asia Pacific Mindfulness Conference. If you've just signed in, well, you're not too late. And I hope that you are joining us from your room, your bedroom, your lounge, on your couch, wherever you are. That's the wonderful thing about being in a virtual conference, that you don't actually have to be physically anywhere together, and you don't need to wear a mask. So we're able to just enjoy the comforts of our home. Perhaps some of you are eating your breakfast, or some of you just getting ready. Wherever you are, let's take a few mindful moments to pause. So just close your eyes and just start with 3 beautiful deep breaths. And just checking into this body, how this body is feeling right now in the moment. Noticing any tingling sensations, any aches or pain. And also having the awareness of the environment, the sounds around us. And tuning into the breath. And feeling grateful this breath is present. This body is healthy. And we are alive. And just focusing on 3 more breaths. And open your eyes. So, a very good morning and welcome to over 300 of you already signed on, and I know many more of you will be signing on as time goes. We're absolutely delighted to be hosting the Asia Pacific Mindfulness Conference. My name is Angie Chew. I am the CEO of Brahm Centre. I also am the mindfulness principal and the chair of the organizing committee of this conference. And good morning to Senior Minister of State, Dr. Janil Puthucheary from Singapore's Ministry of Health, and all the distinguished CEOs and guests that are with us, and all of you friends, ladies and gentlemen, welcome. I'm actually delighted that so many organizations have come together to organize this conference. So if I may just share a slide to show the number of partners that we have in this conference. Includes Ministry of Health, AIC, HPB, IMH, LKC Medical School, NCSS, NHG, NUS School of Medicine, as well as RC4 and Sing Health Duke NUS. In addition, we have international co-organizers, including Brown Mindfulness Center at Brown University, Oxford University's Mindfulness Center, AMIT over in China, and Lazar Lab at Harvard, MISP, Monash University, to just name a few. And we're very grateful to our sponsors whose names are on the list here for their very generous sponsorship in order for us to make this conference possible, as many of you have been able to get tickets at very, very low rates or even complimentary tickets. So we're absolutely blessed to have the support of all these organizations' sponsors, and as well as my team of 8 people who have been working on this conference on a part-time basis over the last 9 months. And all the volunteers out there and my staff who are now also standing up in supporting the call center in case anyone has any challenges in signing on. So this conference has over 70 international and local speakers that's going to be featuring 54 webinars and 29 workshops. It has 6,200 and still counting number of delegates, spanning across 59 countries, the last we checked last night, including delegates from countries like Iran, Iraq, South Africa. So it's wonderful that this conference is held virtually and is reaching to all parts of the world. So while COVID-19 has changed our lives tremendously beyond expectations and anything that we could have been prepared for, but we have a choice in how we focus our mind on what is possible. While many physical doors have closed, including not being able to eat in restaurants at certain times, not being able to gather in large groups, or even travel, but many virtual doors have opened and many new opportunities have opened. When we first organized the Singapore Mindfulness Conference in a hall, there were 900 people. When we took it online last year because of COVID, it saw over 3,000 people attending. And this year we have over 6,000. So as long as we are able to focus on the opportunities, accepting, letting go of what we can't change, and having the sense of gratitude for what we're still able to do and enjoy in life is what makes a huge difference to how we experience life going forward. So this conference is about connecting hearts and transforming minds. Nothing should stop us from still caring for each other, caring for the community, and transforming our minds to keep up with the changes, to let go of resistance in our minds to the new things that are happening in our lives. Our mind is such a powerful platform. It's like technology. It has the ability to build spaceship that sends the man to the moon. And now spaceships are going to Mars. But it also has the power to create an atomic bomb that can be destructive, destroying a whole city or civilization. This mind has the capability of composing the most beautiful music, creating the most impressive structures in the world, and building heartful relationships. But this same mind also has the ability to be destructive and destroy relationships and lives, as we have seen in recent incidents where tragedies have occurred because the mind has gone out of control. So mindfulness has been an enabler for us to become much more aware of what we're thinking when we're thinking it, what we're feeling when we're feeling it, what we're saying or doing as we're saying or doing it. And also to be aware of the urges, the impulses that we may be feeling, that with this awareness, we are empowered to change the course of action and our responses to situations, especially the stressful ones. Many people are experiencing a lot of stress. Healthcare workers, educators, bankers, people in the social service sector, and even students. And if there isn't an approach or technique that can help us calm our mind, this is when we experience burnout, experience insomnia, depression, anxiety, and many other mental health conditions. Now I'm going to show you this slide, this picture. This person is taking the dog for a walk. Instinctively, if I were to ask you, which mind, the one on the left or right, is one that is happier? You would all say the one on the right. This dog is focusing what's in front of it, and it's probably enjoying the walk. The human, on the other hand, the body is going for the walk with the dog, but the mind is everywhere else. And that's why when our mind is cluttered, we stop enjoying the moments. We stop being present and we stop being happy. We can't have a happy life if we don't have a happy mind. So there's such great importance for us to care for this mind, to change our thoughts, the ones that don't empower us, to ones that do, that makes us feel more confident, and to transform a fearful mind into a more fearless mind. We are very pleased to be working with schools, with the medical community, to bring mindfulness to the public, to the students, to the parents, in order to reduce the amount of stress that's being experienced. As we all know, stress over a period of time, especially chronic in nature, will also bring about other physical mental issues. So I'm very, very happy to be piloting a mental health program with a few schools, and also in collaboration with Tan Tock Seng Hospital. Over slightly 10 years ago, I experienced depression. And this was due to my thoughts, how my thoughts spiraled me into a very dark tunnel. Suicidal ideation came up because it was the brain's way of helping me to escape from the emotional trauma and the sense of pain that was so excruciating. I also suffered from anxiety attacks. I never knew I could or I would be. So when my heart was palpitating and the chest was tight and I felt the pain, I thought I was having a heart attack. I felt breathless. I thought I was suffering from lung cancer. And after seeing many doctors, I finally got the right diagnosis. And I was very fortunate that I had been pre-vaccinated with mindfulness techniques. And I was then able to apply them to get myself out of the rut, transforming my mind. And that has spurred me with great motivation to promote and to also teach mindfulness, because it works as a complementary treatment as well as an inoculation against such possible occurrences, as we can't foresee or prevent things from going wrong in our life. So this journey, I'm delighted that so many experts from around the world are coming to share, including our local experts and neuroscientists and researchers, to share the compelling scientific evidence and also the different approaches and practices that can help transform our minds so that we can connect our hearts better. And now it gives me great pleasure and an honor to introduce the guest of honor of this conference, the Senior Minister of the Ministry of Health in Singapore, Dr. Janil Puthucheary, to give his address. So may I welcome, and please join me to welcome Dr. Janil Puthucheary, please.
Good morning, Angie. For some reason, my video is stopped.
Okay.
I should wait a little bit.
Your video should be able to turn on. Let me just check that for you as well.
Yeah. There we go. Okay, excellent. Very good. Good morning. Good morning, Angie, and thank you very much for inviting me to join you and for inviting me to deliver this this address. Let me start properly. Associate Professor Angie Chew, CEO and of the Mindfulness Principal of Brahm Centre. Distinguished speakers, ladies and gentlemen, good morning, and thank you for inviting me to join you today at the Asia Pacific Mindfulness Conference, jointly organized by the Brahm Centre, many local and international partners. COVID-19 has had an extraordinary impact, including on our mental health, as a mental health stress test, if you will, for our whole of society. What I hope to also touch on today in my speech is the extraordinary mental care response that we have seen from formal care providers to members of the community and everything in between. The pandemic has been with us for over a year, and as a result, many people have faced severe disruptions to their lives, to their livelihoods. The impacts have included social isolation, economic uncertainty, and a loss of income. These have contributed to an increase in anxiety and distress among our population. These underscore the wide-ranging impact of the pandemic on our society. What has been our response? I'd like to highlight several things. One example, during this time, we set up a national care hotline, providing psychological, first aid, and emotional support to the public. This hotline, designed to address anxiety and adjustment issues related to the pandemic, received, since its launch in April 2020, over 45,000 calls. Another example, we set up a COVID-19 mental wellness task force in October 2020 to coordinate and integrate agency responses to tackle the psychosocial impact of the pandemic on the population, and also to make sure that we learn the right lessons about our mental health ecosystem to take forward as we think about this very important aspect of care. Many of our agencies, public sector agencies, have responded with several initiatives to help Singaporeans through these difficult times. For example, our Health Promotion Board and our Ministry of Culture, Community and Youth launched a new campaign called Brave the New, encouraging Singaporeans to take proactive steps to support their own and others' mental well-being. As part of this, our Health Promotion Board rolled out a Hi Just Checking In initiative. The Health Promotion Board concentrates on public health education, public health outreach. And so putting this as part of their efforts highlighted the importance of mental well-being. This Hi Just Checking In initiative in January this year focused on equipping Singaporeans with skill sets to provide emotional support to others. Another example, the Ministry of Health Office for Healthcare Transformation rolled out an online platform, mindline.sg, for individuals to understand their own state of emotional well-being using a clinically validated self-assessment tool. We've also provided mental health resources and self-help tools on a website. And so that combination of awareness, education, outreach, and encouraging community partners and community networks to engage and help each other. We've also been increasing the capacity of community mental health services under our Community Mental Health Master Plan. As of last year, we've had over 220 GP partners and 14 of our public health primary care polyclinics providing mental health or dementia services across our country. We've worked with our Agency for Integrated Care to set up 50 community outreach teams in partnerships with our social service agencies, who are often part of the VWOs, voluntary welfare organizations, civil society organizations, who have contributed to care in our community as well, reaching out to hundreds of thousands of persons with mental health or dementia needs. And we've set up allied health community intervention teams, 21 so far for our city, established to provide mental health interventions such as psychosocial therapeutic interventions, counseling for persons with mental health needs in their homes. So an extraordinary mental health challenge, an extraordinary stress test on our mental well-being, and I believe complemented with an extraordinary response from our professionals as well as our community. And notwithstanding the ongoing COVID-19 pandemic, ongoing care, not just COVID-19 care, but ongoing care for health and mental health have had to continue to be made available with added precautionary measures to minimize the risk of transmission. And so these teams, whether professional or from the community, voluntary or trained, have had to be conducted by all kinds of means, including telephone consultations, changing the size of group activities in order to support everyone's mental well-being. Zoom and online platforms like this are being used quite a lot as well. So I'd like to express my deepest appreciation to all our partners, community, clinical, professional, voluntary, who have soldiered on despite the challenges brought out by the pandemic. This pandemic has indeed been a stress test for Singapore's mental health and healthcare systems. I'm heartened by these very significant efforts taken by all our partners, community and mental health system, to address the psychological impact of the pandemic. This pandemic will continue to pose a challenge to the mental well-being and health of our population, since the impact is likely to last for some years to come. The light is there at the end of the tunnel because of the increasing adoption of vaccination, the control of cases here in Singapore, and the number of fatalities under control, the number of cases under control. But this is going to extend for some years. The challenge will be there both in terms of our health and healthcare, but also in terms of the economic impact, which will then have a knock-on effect in terms of our well-being. So we will continue to work on these efforts, building greater resilience in our people to allow us to emerge from this crisis stronger. We have evolved the COVID-19 Mental Wellness Task Force, for example, to an interagency task force on mental health and mental well-being for the whole of government, stitching together all the different agencies and ministries and stakeholders that will be involved in the delivery of mental health care and mental well-being in the public sector, coordinating, making sure that there is better service delivery, looking at our policies and our resource allocations, training, capability development, and very importantly, taking the lessons learned during the pandemic to enhance our mental health efforts for the longer term in collaboration with partners and key stakeholders. The Brahm Centre is one of these stakeholders. I'm very heartened that you've impacted the lives of over 64,000 people from all ages and backgrounds in your mental health outreach efforts. And with the intent of strengthening mental resilience and peer support for youths, the Brahm Centre has introduced a mindful academic coaching program in February this year, providing free one-to-one academic coaching and guided mindfulness practice for secondary school students. And the Brahm Centre will also be partnering our Institute for Mental Health, our tertiary referral center for mental health in Singapore, and the Harvard Medical School to pilot a mindfulness-based mental health literacy program in schools. This will allow students, parents, and teachers to gain a deeper understanding and an appreciation of how our minds work to achieve an effective learning and emotional regulation. Once again, I'd like to thank the Brahm Centre and all our mental health partners for your extraordinary support and efforts during these difficult times. I hope we can continue to work together to foster greater mental health care, resilience, and well-being in our society. To all our participants today, I wish everyone a fruitful and fulfilling time at the conference. Stay well, stay safe, stay strong. Thank you very much. Back to you, Angie.
Thank you very much, Dr. Janil, for the kind words of encouragement and inspiration. And now I'd like to also invite our distinguished guests to turn on their videos to join us for a group photo before we start the roundtable discussion. So Mr. Tan from Agency for Individual Care, Daniel Fung from APMC, Kevin from ATINAT, Professor Peter Pang from RC4, Tan Lee San from NCSS, Dr. Philip Chew from NHG. So I just want to make sure that I get all of you in the gallery stride first. Thank you. All right, so if you could all look straight ahead at the camera on top of your screen, that would be great. And I'm going to count 1, 2, 3. Okay, let's do it one more time. Okay, I'll just let the other photo disappear first. Okay, ready? 1, 2, 3, smile. Thank you. Okay. So welcome everyone in joining this roundtable discussion. It will be a short discussion as we will be having our keynote speaker coming out very shortly at 9:25. Gives me great pleasure to have all of you distinguished guests with us this morning. And I'm going to start off by inviting Professor Philip Chew, the Group CEO of National Healthcare Group, to share his remarks as to how mindfulness is expected to help the healthcare workers and also patient care from your perspective. Professor Philip Chew, please.
Hi, morning, Angie. Thank you very much for the invitation. Our history with mindfulness started actually in 2010, and that was actually when IMH first brought it into NSG. And in a very short time period, it actually spread over to all the various institutions. It was one of those programs where quite unusual. The ground was actually very excited by it, and they embraced it very quickly. To us in management, we supported this because we realized actually that it was almost like a program that actually strengthen and prevent stress in our staff. Actually, nowadays in the area of COVID, it's almost like a vaccination program to do it. And it's now part and parcel of what we do. And we do it for all our leadership, for new people who join us, as well as actually for most of our doctors and staff. Is actually part of their training program to actually take part in some of these things here too. It helped us a lot during the COVID times, and we had to actually do a lot of new things too, because even though we have been around for 10 years, we realized actually not everyone actually has gone through this. And during this particular period, there were actually lots and lots of lunchtime sessions where we had to do and bring in a lot of this mindfulness program to everybody to help it out. We have to actually augment it with a lot of things too, a lot of first aid support to all our grounds and staff. And we realized that we actually have to have gaps in activities. No matter how much we do to inoculate our people, we realize that we need to give them periods of time off. In particular, working at home, Zoom was a major issue. We have to tell people to limit the timing and to make sure that there is actually in-between breaks to all of those things over there too. But in truth, I'm very thankful actually that we have this program with us during this time to help our people. And thank you very much again for this invitation. Thank you.
Thank you very much, Professor Chew, for your inspiring words. And now I'd like to invite CEO of Agency for Integrated Care, Mr. Tan Quang Chik, to share with us what are AIC's plans on promoting mindfulness to improve the well-being of its staff and also the aging service sector.
Thank you so much, Angie. First, just to thank you for inviting us and also to thank all of you for taking the time to attend today's conference. As Angie has highlighted, I think for AIC, we have Agency for Integrated Care. We have embarked on this journey of introducing mindfulness and as a tool, as an enabler, as an important program for our staff since 2015. And this is also in partnership with Angie and the Brahm team. Over 500 of our staff has gone through mindfulness and as a foundational learning, and that has been really beneficial, for our staff in terms of improving their mental well-being, improving emotional connection and ability as well to connect with the teams and individually, at the workplace. So the feedback has been really positive, and we want to, as a whole, be able to achieve overall workplace well-being and to be able to safeguard the health of all our staff in AIC. And I'm sure that applies to all of us, whether individually or within an organization to do so. And particularly, during this time, as we go through the roller coaster challenges of the COVID-19, where it has really impacted all facets of our lives. And many of us, I think, continue to work from home, and the challenges that come with that, as well as the lack, I feel, of social connection has continued to impact, on all of us, our team. And so I think the onus is for us to continue to leverage on mindfulness, as a key enabler for our staff to benefit them and continue to move this forward as a key foundational skill, I feel, and learning for all of us in AIC. Of course, I think it's not just limited within AIC. Brahm has been a key and strong partner of AIC in terms of rolling out community-based program to be able to outreach, be able to care for clients and seniors in the communities on the mental and physical well-being. And Brahm has been our partner since 2016, has run community outreach team, done great work in the areas that they are in. I want to acknowledge and appreciate the strong partnership and support from Brahm in our community mental health programs that we continue to drive. And this is particularly critical in my view as well, as we continue to grapple with COVID-19. We continue to need to focus on the mental health and well-being of all of us around in the community. And even as light is coming at the end of the tunnel, I think this needs to continue to be the focus going forward, because indeed there's no health without mental health. So today's conference is also really timely, and I want to congratulate Angie and the Brahm team for organizing today's event, and wish you a most interesting and beneficial learning experience ahead. Thank you so much.
Thank you very much, Mr. Tan, and all your acknowledgement. And now I'd like to invite Professor Janil Fung, who is the CEO of Institute of Mental Health, to share his take on how does he see mindfulness being applied in IMH from the perspective of care and also for the well-being of your staff. So Professor Janil Fung, please.
Thank you, Angie. I'm also mindful of the fact that she told me I only have 2 minutes to keep to this.
It's okay, Mr. Tan took more than 2 minutes, so
Yeah.
I will be fair.
Well, but to be fair, I only have 2 points to make. One is that I think mindfulness-based interventions have really 2 dimensions to work within. There's much said about how it is being used in healthcare, which is very illness-based. And there's, of course, increasing evidence based on the treatment of emotional disorders. But I think from a mental health perspective, where well-being is concerned, I think more research may be needed. So IMH is interested in both these dimensions. We use mindfulness in dialectical behavior therapy and acceptance and commitment therapy, DBT and ACT. And these are important therapies in dealing with emotional dysregulation. We also have certified .B practitioners working in our school-based teams. So I think there is a growth that is needed in this area and probably more research to see what are the exact benefits, not just on the pathogenesis side of the house in terms of illness, but on the salutogenesis side of the house in terms of well-being and the quality of life. So we look forward to learning more about the science and the art of mindfulness-based interventions at this conference. And congratulations, Angie, for doing this doubling of participants every year coming.
Thank you, Professor Janil Fung. Indeed, what you have said is very much needed to have the evidence to back this, the treatments or the approaches that we're talking about here. So I hope all of you will be staying back for Dr. Richard Davidson's sharing of the neuroscience research that he's been doing for the last decade or more. And now I'd like to invite Dr. Craig Hassard. Are you there, Dr. Craig Hassard? Yes. Welcome. I know you had a little bit of a challenge signing on this morning from Melbourne, Australia. So welcome, Craig, and I'd like to invite you to share your take on the benefits of mindfulness for the Monash students, medical students have been trained under you, and also the professionals in the healthcare sector. So thank you, Craig, for joining us.
Hello, Angie. It's great to be with you again, and with so many people all around the world. So warm welcome to everybody, and what a great initiative this is. Just very briefly in my 2 minutes, we've been using mindfulness as a part of the core curriculum for our medical students since 1992, and it's grown a lot over the years, so that all of the medical and allied health professionals get some training in mindfulness. And we see it as a core life skill and professional skill. So just a few perhaps points around that. And these were the kinds of things that had to be put towards the faculty and Australian Medical Council to make the case for why this should be included as core curriculum, not as an elective, as core curriculum, which it has been, as I said, for approaching 30 years. The first thing is the personal need. The mental health and well-being of health professionals, the stress, mental health problems that are very common, especially among doctors, and physical health as well, because our mental health impacts on our physical health so directly and indirectly. Coping with workload, being able to sleep and switch off at the end of a really very busy day. So the personal needs. The second thing, the second category, if you like, is to have better doctors and allied health professionals. And so that is through greater awareness, better attention, more vigilance, so safer health professionals, less errors, better decision makers. Because if we're more aware, then we certainly can make better decisions and be aware of what's motivating and driving those decisions and assess situations better. Reducing the mental load from a very full working day, but also more compassionate health professionals who can communicate better and be more mindful in the human interactions that are just a part of that kind of working life. So the third thing is that the modern health professional needs to have more than the script pad to go to. So using mindfulness as either the therapy or as an adjunctive therapy to other medical treatments is very important. And that includes both for mental health problems, but also for physical health problems, helping patients to cope with illness, serious illness, very often life-threatening illnesses. So coping better, and for patients to cope with stress and demands of day-to-day life, and also to help patients to find peace and quality of life and to understand themselves better. So, and I think that doctors and other health professionals can really help to give those skills to people. So there's many, many different reasons, but I cannot think that the modern health professional can really go into their working life without knowing and understanding these kinds of principles personally and professionally.
Thank you very much, Dr. Hazard. And now I'd like to invite Professor Peter Fung from RC4, the Residential College 4 of NUS, which is the only college that offers mindfulness at this time. So if you would kindly share how mindfulness have impacted the students and also your words of encouragement for the learning community in embracing mindfulness. Professor.
Thank you so much. Thank you so much, Angie. It's a real privilege for us to be a partner of this wonderful conference. We've been partnering for a few years and we've seen the exponential growth and the impact that this conference is making in our society and around the world right now, right? Mental illness affect across the society, but it affects the youth in particular, right? Because youth, I think that there are two aspects to it, right? The university is a stressful place. I think we all know this, right? And because people feel that they need to perform well, they need to study well, because it's very high stake, it's going to affect them for the rest of their lives. All right, so that's the first aspect. And the other one is that youth, I think, are very busy. They're trying out many, many things. They're trying to study, they're trying to make friends, they're trying to learn about the world, experience different things, and so on. So they're very busy and therefore their mind is very cluttered, right? I am reminded of the cartoon that you sent earlier. So in fact, when I talk to students, I often tell them that, look, one of the most sought after skills in this world that will determine your long-term success is your ability to concentrate and to focus, right? I think that mindfulness is one way, right, to help people, especially youth and students, to concentrate and to focus, and in particular to focus on what really is important in life, right? Because there are simply too many things. And I think the students in RC4 are very lucky, as you said, because they benefit from your teaching. We are very, very lucky to have Angie teach mindfulness in RC4. So she doesn't just teach the practice, right? But also the theory, the science behind mindfulness. And indeed, some of our students are going to share during this conference about how mindfulness helps youth build mental resilience and to live out their full potential. I don't know whether Gavin, Ethan, and Xiao Yi, whether you are here or not right now this morning. So, Angie has been teaching mindfulness in RC4 for a few years, and many students have benefited. Let me just end by congratulating Angie and her team for putting together this wonderful conference, and I wish everyone really great fun and enjoyment going through the conference. Thank you very much.
Thank you, Prof Fung, and thank you very much for your support. In fact, these Zoom rooms have been sponsored by RC4, so thank you. And now I'd like to invite the CEO of National Council of Social Service to share on how does NCSS plan on supporting mindfulness to improve the well-being of the social service sector. So may I now invite Ms. Tan Lee San.
Thank you so much, Angie. If I may start a little bit more broadly, this issue of mental well-being really has become so much more salient during the pandemic, as our guest honor, Dr. Janil, said earlier. And in NCSS, we conducted 3 dipstick polls on quality of life over the past year at 3 points. during our lockdown circuit breaker phase 2 and about a month ago. And we found that, anxieties, especially over employment, finance, have really been sustained throughout this period. There was a slight uptick when going into phase 2, but since then it's been stagnating. And I think, as we move even into endemic, there are a lot of concerns about the future. And therefore, so much more critical that we take care of our mental well-being and mindfulness practice, being focused on the present, being focused on possibilities, Angie, as you say, is really such an important coping technique. For NCSS, I would say we have 3 target audiences, just very quickly talk through each of them. I think one is at the community level. We are a member of the Interagency Task Force on Mental Health and Wellbeing, as Dr. Janil talked about. And an important part of the strategy, I think, that we are coming up with is really encouraging help-seeking behavior, encouraging people to sort of build resilience. And that's something that in NCSS we have been doing. We launched our Beyond the Label campaign more than 3 years ago to combat stigma, educate the public on mental well-being techniques. And we had a number of workshops on mindfulness. And our campaign last year reached a record number of people, more than 100,000 for the first time. We also support users of our social services. We've established mental health as one of our 3 service priorities. We fund programs, from crisis hotlines to counseling centers, including mindfulness-based sort of cognitive therapy practices. In the coming years, we really want to focus more on this as well. And I think as finally, as the demand for social services grow, we do need to support our social sector professionals as well. So you asked about mindfulness for the sector. Recently, we launched our Caring for Social Service Professionals scheme, which encourages our social service agencies to provide employee assistance programs to their staff, and a number have come on board. So we want to thank them also for supporting their staff. I think we will continue to work very closely with our partners to better serve these 3 groups. Actually, someone pointed out to me that they formed the acronym CUP: C for community, U for users, P for professionals. Kind of not a very elegant acronym, but nevertheless, a useful one, to think about mindfulness as seeing, being in the present, being grateful for what we have, seeing the cup as half full. So with that, I just want to thank Angie and Brahm Centre for organizing this conference, for inviting us, and I look forward to it. Thank you very much.
Thank you very much, Lisan, for letting us know what your plans are and how we can all play a part in upgrading this sector. Okay, and now we have, last but not least, Mr. Kevin Fung, who is the founding teacher of ATINAT, Institute of Mindfulness Training in China. And do share with us what you observe of China's mental health, and also the part that mindfulness has in terms of helping with their mental well-being. Mr. Kevin Fung, please.
Hi, good morning, Angie and everyone. It's lovely to be invited. Thank you very much for inviting me to join this work. And it's lovely to see that how mindfulness has grown up from Singapore, one conference now including China or Asia in general. This is a big topic about how mindfulness is playing a role in mental health in China. Obviously, the government has this Healthy China 2030 initiative that is squarely putting mental health as one of the key focus for the public health agenda in the coming 10 years. And obviously, they're not only looking at mindfulness, there's a whole myriad of initiative that was being looked at, but definitely mindfulness is one of the key areas that we think I'm hoping to really promote since its arrival to the contemporary mindfulness arrival in China about 10 years ago in 2011. And since then, has been a lot of initiative happening around different area, from before birth, from the childbirth, all the way to taking care of the aged and initiative. So I think for me to see mindfulness playing a role in the mental health in China, the key thing would be it has to to make it inclusive for everyone. So keeping it secular and include of all walk of life. And also a good degree of localization is required Currently, we are absorbing a lot of the process and classes and programs from around the world, but China is a big country with a lot of different needs and local culture. So I think we're in the stage of looking at how to adapt some of these programs to make it relevant to the people. And so currently it's really in the concept, well, even though after 10 years, a lot of initiative is being taken, for example, by the Center of Disease Control on childbirth and parenting, and to the China Association of Life Care in terms of using it in school, in the penal system, and in different, of course, healthcare and so on and so forth. But at this stage is really still getting to prove this concept so that we can really getting the support from the public-private collaboration. And the important area, of course, is having the academic research or the scientific research continue to prove the efficacy, and that is saved for people to make use of this sort of like modality for the improvement of the mental health. So I think this is a lot of potential in here, and it is already happening leaps and bounds. We have over 300 trained together, my MBSR, MBCT teachers, and a lot of other programs are being taught here to train newer teachers. But this is a very big country, so I'm really glad to see to have this initiative with combining activity in the Asia Pacific region, and that we can learn from each other. This is a wonderful thing. So really thank you, Angie and the Brahm Centre and the team to invite us, to invite everyone into this initiative. So thank you.